Dear friends, today on World Liver Day, I shall be talking about the cirrhosis of liver. Cirrhosis of liver is a chronic disorder in which parenchymatous tissue of the liver is replaced by fibrous tissue. It is caused by repeated assault to the liver by toxic substances taken. The functions of the liver are manifold and it is a dynamic organ next to brain only. It helps in digestion. It helps in storage, detoxification of alcohol, detoxification of drugs, harmful toxic substances, poisons. Then it also helps in storage of certain substances like glycogen, and in times of need it breaks down into glucose for use in the body. Then the liver also helps in protein, carbohydrate and fat metabolism. It also helps in activation of enzymes in the body. So with manifold function, liver is essential for life. What causes repeated injury to the liver leading to cirrhosis of liver? First and foremost is the viral infections of the liver causing hepatitis. It could be hepatitis A virus, it could be hepatitis B virus or hepatitis D virus. All these viruses, they enter the body, especially hepatitis A and D, they enter through the infected food, infected water, contaminated substances. These viral infections are also through the infected needles, blood transfusions, sexual contacts. All these can lead to hepatitis. Next is alcohol. Alcohol abuse. By the time any person takes alcohol, it is always detoxified by the liver cells, and during detoxification, in every time some of the liver cells they die, but due to dynamicity and robust cells of the liver, these cells are replaced. A time comes when excessive use of alcohol cannot compensate with the repairs of cells, leading to hepatic injury and cirrhosis. Then some drugs, chemical substances, or these can lead to inflammation of the liver in first stage. Inflammation leads to swelling of the cells and later on damage of the cells. Repeated injury to the liver causing inflammation will lead to fibrosis of the liver, and fibrosis will lead to cirrhosis. Now, how will we diagnose the early signs of liver damage? Early signs are when the liver is in inflammatory stage. In that time, there could be nausea, weakness, fatigue, later on leading to pain abdomen, abdominal fullness. There could be vomiting, loss of appetite. Inflammation further increasing will lead to development of jaundice, yellow coloration of the eyes and the skin, itching all over the body. The urine will become dark yellow. When the jaundice will increase, the stool become pale. It may become whitish. further increasing when the obstruction develops in the liver due to fibrosis. It impairs with the flow of blood through the liver. All the blood from intestine with absorbed food material, they are taken to the liver by portal veins. These becomes obstructed. Portal pressure rises. There could be swelling of the legs, ankles, foot. Then there will be swelling of the abdomen. Fluid will accumulate in the abdomen called ascites. So there will be distended abdomen. With these features, in the terminal stages of cirrhosis of liver, there could be hemorrhoids or piles. It will start bleeding. Esophageal veins also enlarged, leading to esophageal varices. And bleeding from esophageal varices means dilated veins will lead to vomiting of blood, or there could be passing of black tarry stools due to digested blood from the stomach. So these are the clinical features of terminal stages of cirrhosis. Fatty liver is one of the causes of liver cirrhosis, which is common nowadays. There is deposition of fat in the liver, especially cholesterol and triglycerides. So, in cases of fatty liver, cholesterol and triglycerides should be avoided. Also, deoxycholic acid is useful in the cases of early inflammation of the liver. Now, how can we prevent cirrhosis or liver injury and we can lead a healthy life? First is avoidance of substances causing liver injuries. To prevent viral infections, the food, the water, the drinks should be clean. Hands should be washed with before each meals. Close contacts with the persons having hepatitis should be avoided. Needles, syringe should not be used twice. Used needles must be thrown at a proper place, must be disposed at a proper place. Blood transfusion precautions should be taken with all the viral markers taken. Then stop alcohol is the only way to prevent liver injury in alcoholic persons. There should not be smoking. Chronic smokers also develop liver cirrhosis. Obesity should be reduced. Regular exercises, at least half hour brisk walk or mild to moderate exercises should be done. Weight reduction should be done at all costs. Much fat should be avoided in meals. White flour, maida should always be avoided. Bakery products should not be taken by the persons who has some liver injury or liver weakness. Any persons should not be taken bakery products regular. Pizza, burger, etc. Fruits are helpful to the liver, especially grapes. Then the orange, apple, these fruits are helpful. fiber diet should be taken. So these are the substances which are innocuous to the liver. Unnecessary use of drugs, analgesics, acetaminophen, NSAIDs should be avoided because most of them are detoxified in the liver. So the substances in which liver has to work is to be avoided. In terminal stages, cirrhosis can be treated by liver transplant. A piece of healthy liver from healthy donor can be taken and can be transplanted to the person suffering. The liver cells transplanted, they regenerate and the diseased person or the patient leads a normal life. Whole liver can also be transplanted if cadaver liver is available. Persons with liver transplants, even whole liver transplants and partial liver transplants, they are leading a normal life for 15 to 20 years. So, with precautions of diet, exercise, weight reduction, avoid fatty foods, the further liver injury can be prevented if the person stops smoking, if the person stops alcohol completely. So, the message is for the liver health, excess of everything is bad and proper care has to be taken regarding diet, regarding exercise, regarding hygiene. Thank you very much.